Start, sir.
Okay. Hi. So we learnt something about skin suturing. We are going to learn some hand knotting techniques. So why are hand knotting techniques important? Where are they used? So they are used inside the cavity of the human body, commonly used in abdomen for a general surgeon. It can also be used in thorax or cardiac surgeries or neurosurgery also. But commonly used in general surgery is in the abdomen, where we are not very confident or we are not very sure about using the instruments, and we don't have much space to use multiple instruments at that time, and we don't want to give the benefit of doubt about the strength of the knotting to the instruments alone. That is the idea. So there are two types of hand knotting techniques. So I am going to demonstrate using my right hand for right hand surgeons. We are also going to demonstrate the left hand knotting also. So first is one hand knot. So here if you observe, I am going to keep the white colored thread stable. I am not going to use it for knotting. So here right hand, that is the colored part of the thread, is taken in a manner of one finger and it is used to cross over the white part of the thread. We have an option here that we can take the left hand to the front, so that we have only one thread here to avoid confusions, or we can always make a shape like a 4 or a triangle and then hook out the white part or the colored part under the white part. So if you can see here, I am going to hook the right hand part of the thread with the right hand. My left hand is not doing anything, and I am going to hook out of the loop, and then the knot is done here. So this we are going to place it here. So again, to show on the same knot with the white part of the thread, I am going to go over the left hand and collect the right hand part of the thread in between the loop and coming out, and then orientation of the knot, and then we are going to knot it. So this is one hand technique or two finger technique as it is called. There is another technique which is called two hand technique or four finger technique as it is called. That is starting, we are going to hold that the earlier knot we held the suture material like this. So here we are going to hold the suture material with the right hand in a manner like super. So we are going to hold it like this, and we are going to go under the left hand. There we went over the left hand. Here we are going under the left hand, and again if you see here, the same 4 is being made, and again we are coming in the loop and collecting the same knot via the loop. So the knot is done here. Again showing on the other side of the thing. So we are going to go under and collecting the same suture material or the thread via the loop and taking it out. So if you see here, the knot is done. So here I am going to show the one finger knot over left hand, collecting the same knot, same thread, and coming again 4 finger knot under, collecting the same part, coming, and the knot is done here. So if you can observe earlier what we did, the knot, the orientation of the knot, if you can observe, I did the same knot which looks like a granny knot here, means it is just loop over the loop. If you observe the two knots which are done now, it is I used one finger knot, next I used four finger knot. So if you see the knot, it is in the reef knot technique, which is supposed to be very stronger. If you see, it is like an 8 and which is symmetrical, not asymmetrical like the first knot here. So this is a reef knot. So this how to form this knot? Reef knot is more secure knot. How to form this knot? We use one finger and two finger or two finger and four finger knot alternatively. So if we use one after the other, the knotting will come in a reef knot fashion. So let's do the same thing with the left hand. Also we can learn with the right hand. So it's very important for a surgeon to know hand knotting techniques in both hands, because you never know how it comes handy. So here we are going to hold like a chariot thread. So again, left finger over the right finger and collecting the left finger thread. Right finger thread is not doing anything, it is just keeping quiet and it is straight. It is collecting the left finger via the loop and the knot is done. Knot is done. So again I will show the left hand over the right hand, collecting via the loop and the knot is done. So this is what I am telling. If you see, observe the knot, I use the same knot with the same hand. So note the asymmetry of the knot. It is not reef knot. It's not a reef knot, but it is a squared knot, not a reef knot. We will continue with the four finger knot. So we are going under the right hand, collecting via the loop and reorient the knot. And if you already observe, this is become a symmetrical knot because I used one finger knot and two finger knot next to each other consecutively. So again I will show under the knot, under the right part of the thread, and collecting the same left hand thread and pulling it. So again, if you observe, this becomes a granny knot because I used the same knot with the same hand. So if we use the two knotting techniques consecutively next to each other, it becomes a secure knot. If you use the same knot over and over in the same hand, same knotting technique, it becomes unsecured knot. Let's see what happens if we use alternate hand, both hands, both techniques. So let's see one finger knot from the right hand, left hand, one finger knot again, so again if you see, the reef knot has come here. That means if I use the same knot with the alternating right and left hand, it becomes a reef knot. Or if I use both knots in the same hands, it becomes a reef knot. This is a four finger technique. So again it becomes a reef knot. So this is a reef knot, four finger technique, two finger technique. So if we use one finger technique with the right hand and the left hand, it becomes a reef knot. If you use one finger technique with the right hand and right hand only, it becomes unsecured or a non-reef knot. That means alternate the hands to make it reef knot, Or if you use one finger technique and two finger technique in the same hand, it becomes reef knot, either left hand or right hand. Or if you alternate the hands, it will be the alternating the hands and same knot. If you are not used to both knots, you have to alternate the hands. If you are alternating only one hand, using one hand for knotting, you should alternate the knots. That is the idea of knotting. So let's see what is the combination of both knots at the same time with both hands. So I am using right hand 4-finger knot over and collected, and this is under and collecting. So if you combine both at the same time, this becomes double throw, which is supposed to be surgeon's knot. So we are going to do again one hand going under, one hand going over, and it becomes 2 throws. So that becomes surgeon's knot. So since we are using 2 throws in surgeon's knot, why 2 throws in surgeon's knot is the convexities and concavities will sit on each other's opposite orientation, so that they will become more secure knot. The crevices will bridge and complete the knot and make it more secure knot. So if you use both hands simultaneously at the same time, it becomes a surgeon's knot. So that should be used for more secure and more stronger knot in the abdomen. So this is the hand knots. At the same time, what is the advantage of hand knot is, here we had space so that we took our hands here, there and all. So there are some situations where there is no space like it might be a gallbladder bled, or it might be a small incision of thyroid, or it might be an appendicectomy wound which is very small enough so that we are not having much space. So and we want to, suppose we will imagine this is a appendicular artery and you are going to tie the appendicular artery, otherwise that appendicular artery will slip and it converts itself into right hemicolectomy. So that is supposed to be the appendicular artery or whatever for reference. So we are going to put a knot here. So we are going to use the hand knot, and if you see, if I keep the left hand straight, the knot will slide. The knot will slide. So we will use that sliding part and we can make the knot sit wherever it has to go, and we can pass point and make it tight, and then we can complete the knot again by putting how much ever knot depending on the what suture material we are using, like synthetic non absorbable sutures require more knotting like polypropylene, nylon and all, and some are braided materials where we can use 3 to 5 knots, more than enough. So again, if you see, I was stressing on the same hand, same knot. If you see here, it is a granny knot. So you don't want a granny knot inside an abdomen. So obviously you should learn both hands, both knots. So either alternate the hand or alternate the knot so that it becomes more secure knot, like I am going to demonstrate now. So now we have kept it, and we are going to place the knot, and now we are going to use the other knot so that it becomes secure underneath. Secure underneath. So once there is a secure knot, the more and more we tighten, that becomes more and more tighter, and when the tissue edema sets in, it makes the knot more tighter, not looser. So that is the advantage of making a secure knot inside the abdomen. So as you can observe, this is more secure than our previous knot. So previous knot, though I tried to shows the past pointing and all, still it was little loose. So here it is tight enough. So this is how the cavity knotting is done. So basically one limb is kept straight so that we can slide the knot inside. So that same principle is used for laparoscopy also, where it is called tumble square knot. That means tumble square knot means we make a square knot outside the body and we keep one edge straight and we slide it. Like we can make a square knot without tightening. So now this is a square knot. This is supposed to be the secure knot. Now let's keep one edge straight. If you observe, I am going to keep the colored part of the knot straight. So the reef knot is going to tumble itself. That means it is going to twist itself. Yes. Now this becomes a sliding knot. This becomes a sliding knot, and then we can wherever we want, we will make it straight and then pull it opposite sides, so that it will reorient itself and become reef knot again. So this is called tumble square knot, which can be used for making the thread slide wherever we want to, so that it will occlude whatever we want to occlude. So these are the common hand knotting techniques which are used in general surgery. Hope you all noticed the technique of hand knotting, and you will also practice. I recommend that you practice with a larger suture materials like this for practice, so that you can orient itself which knot is which type of the thread should be held and which part of the thread should be pulled. So those things can be practiced at home. As a surgeon, it is not good to practice on the patient directly, because to avoid harm to the patients, we should practice all this at home, so that we are well trained when we get the opportunity for better benefit of the patient. Okay, thank you.